We're here to talk about the Physicians Health Program feature in the Pitt on season 2, episode 4, where Dr. Langdon and Dr. Al-Hashimi are discussing Dr. Langdon's participation in the Physicians Health Program. I'm joined by Dr. Kim, our medical director for the Physicians Health Program in Pennsylvania. And online, I've seen lots of questions about what physician health programs are. Can you give a brief description to the general viewer of the PIT on what that is?
Absolutely. Thanks for having me, Julie. And it's interesting. I watched that episode. If you watch media as I do with closed captioning or subtitles, very interestingly, they do capitalize physician health program when Dr. Al-Hashimi mentions that, and I was struck by that. And they were correct in capitalizing that because a physician health program is a formal entity. So, a physician health program is essentially a resource for healthcare professionals who are safety sensitive occupation workers and a mechanism for these professionals to seek care in a confidential and private manner. A physician health program will support physicians, nurses, dentists, pharmacists, many other licensed healthcare professionals in first understanding, getting screening for an illness which may be impairing, and that can range anywhere from a mental health concern to a substance use disorder. And so a physician health program really engages that professional from the beginning in terms of helping screen for an issue, providing resources, connecting them to an evaluation, and so forth, and treatment as well. And one of the keys here with the physician health program is, as I mentioned, it's a formalized program. There's a structure in place. And part of that comes from recognizing that healthcare professionals are a unique population, right? They have unique challenges that come from both their professional life and rooted in their personal life and the intersection of those. And so when a physician health program helps these individuals, they're getting connected to experts. So it is a little different than going to, let's say, your primary care physician or a private counselor or even your employee assistance program, which are all great resources for our professionals. However, the key point here is that there's a network of experts that work specifically with healthcare professionals who understand the daily tolls, professional burnout as an occupational hazard, the realities of modern medicine and healthcare, and how that impacts um, how people uh, manage their stress and illness.
Now, in this specific scene with Dr. Al-Hashimi and Langdon, she says, I think it's great that you are a part of the Physicians Health Program. I know it's hard. And Langdon replies and mentions that he's almost done with his first year of monitoring, I believe. Can you explain a little bit more about what an individual going through this process, what their path might look like?
Yes, absolutely. And based on what I know of Dr. Al-Shimi's character, I'm not surprised that she understands or recognizes what a physician health program is or was or is. I think that simple statement carries a lot of weight, meaning she understands precisely what Dr. Langdon is going through. And what Dr. Langdon says in response is characteristic of the Pennsylvania Physician Health Program, in which this was modeled after. So, if a physician enters into an agreement with the Physician Health Program, it is a highly structured agreement in which The physician is placed into a standard 5-year agreement in which we monitor and also advocate for the physician. Uh, so what that entails is the physician agrees to a set of parameters, meaning they're engaging all the resources that are available to them, meaning medication management if it's necessary, individual therapy or group therapy if it's required. This is an abstinence-based program. Dr. Langdon specifically is suffering from at least benzodiazepine use disorder, so there'd be an expectation of drug testing. And I think Dr. Robby alludes to that in season 1, where he does say you're going to be drug testing and going to meetings, and that is really at the core of what a monitoring agreement entails. The other part of monitoring is connecting a physician to a network, right? So letting a physician experience the camaraderie of, let's say, caduceus groups. This is a group of physicians who are also in recovery. They know what it's like. Again, the unique challenges of being a physician struggling with an illness such as substance use disorder. Uh, it brings on its own challenges. So getting connected with that group, exploring mutual help groups, anything from Alcoholics Anonymous, Celebrate Recovery, Dharma Recovery. Um, in all that, what that is encapsulated in is this kind of structured approach, right? So it's a little different than Dr. Langdon just going out to his private psychiatrist and saying, I need some help. This is really a comprehensive approach to supporting Dr. Langdon. And as you see, just by the nature of him being there, having an illness such as a substance use disorder does not preclude him from being in the workplace. Right? He's there in the ED, seeing patients, providing care, and that is thanks to the very unique relationship that a physician health program has with uh, employers, health systems, training programs such as a residency program, as well as the Commonwealth. There's because the program is so comprehensive, there there are layers of trust that are built in and layers of accountability that permits someone, like an attending, such as Dr. Alashimi, to say, you're in good hands. You know, if you're in a physician health program, I know it's strict, I know it's regimented, but I also know that with their advocacy, you belong here. You belong in a place where you can practice what you are passionate about. So, in those two simple lines, I think just there's a lot to unpack, and I really do understand where people have that question. Um,
Along with that, we're touching a little bit on how they feature the complicated return to work for Dr. Langdon. And that comes with some tension between Dr. Langdon and Robby. You can, I mean, these are spoilers, but you can sense that there's some tension between the two, at least on Robby's end. Um, you mentioned that there are levels of trust and accountability. Are there, this is more for an audience member, more of an audience member question, but are there things to look out for that in Dr. Langdon's return from work that would be a level or an example of accountability or an example of trust that they may see in their own workplace or that they may experience? What are the safeguards? What are some examples of allowances? Yes.
yeah, I think so. Credit to the writers and the cast when we were being consulted on this. that was one of their specific questions is what is it like for a physician to come back into the workplace, and what is it like for the workplace to try to manage this? And again, our my perspective was we're the physician health program. If we're going to help this person and say they're okay and guide them through the process, there's a level of confidence that we're going to tell you that this physician is fit for duty or can practice with our advocacy. But that doesn't change the reality of the stigma out there, right? The very human relationships that occur in a professional setting, right? There's a level of hurt. There's a level of often when I'm going to dive into the dynamics here a little bit, Dr. Robby and Dr. Langdon, they were, I imagine, very close, right? A supervising attending and a resident. Uh, I, I believe they had this relationship where Dr. Robby really mentored Dr. Langdon, and Dr. Langdon really looked up to Dr. Robby. And you introduce something like this, the series of events that occurred. Uh, that's a very interpersonal relationship that doesn't get solved right away. And I think I'm interested to see throughout the season how Dr. Robby navigates this, how he recognizes maybe, the things that he sees in Dr. Langdon, how close to home that really resonates and hits home with him. Um, so yeah, I just a reminder that, and this is what we see almost on a daily basis, is this level of both fear from the participant side of how will I be treated, um, and also from our administrators with whom we work. How should we approach this? We want to be supportive, or we've never encountered this before. How, so you're saying that this physician can come back to work, but what else do we need to do? And it is it's a balance, right? You need to make sure that there's accountability, but that you still maintain that attitude of support so that the individual can really thrive, not only on a personal level but professionally. Right? I think those have to be treated nearly equally when you're talking about our healthcare workers and patient safety and all the complex issues that come to play.
I think your use of the word support is very important there because people can think of it as restriction, but it's support. It's really the physician's health program, looking out for physicians. We talked about Langdon and Robby's relationship and how there's obvious hurt and strain there because it was a mentor-mentee relationship, and there's obviously a level of friendship. But there's also seems to be some things going on with Dr. Robby. We can sense a level of burnout, which I think has been displayed throughout both season 1 and 2. And this season, it is mentioned that he has this shift, and then right after he's leaving to go on his sabbatical. Also during the season, he's confronted by a social worker from upstairs who asks him, "How are you? What are you dealing with? What's going on?" And Robby says, "Well, I'm not on your couch right now." Obviously, this puts physician burnout kind of at the forefront of the conversation too. Would you be able to speak to the relationship between the PHP and physician burnout?
Yeah, that's as with many things in the show, such a timely presentation of the challenges that healthcare professionals face. And it is kind of a slow burn, right? We're seeing this juxtaposition of the residents' health being put into question and also the attending physician who obviously has a tremendous weight that he has to carry to support his patients, the unit, and his trainees. And it's all, there's only so much he can handle, and it's all buckling under pressure. And it's almost a natural kind of approach to this, right? He's forced in a way in his perspective that he just has to completely disengage, right? Go on this sabbatical, this complete detachment from the workplace. And that's a sign, really, that one, that he's really invested in what he does, right? In all aspects. And I think from a physician at that level, you really you really don't see an out. You don't see a way for someone to turn down the volume on or the intensity in this regard without understanding the ramifications, right? If you're not giving 100%, well, the service falls apart, or the residents might make a mistake, or patient doesn't get seen, or any one thing of the variety of stressors that occur. And I think this highlights just very much how physicians feel trapped, right? The tremendous amount of responsibility. And we're starting to recognize that burnout is not just based on the individual and the stressors they face and how they feel it, but it's a systemic issue, right? And the systems understand that. And they're trying to figure out how to support these individuals. A physician health program is one component of the system, recognizing that physicians cannot address their burnout on their own, right? Because if we leave it to physicians or healthcare professionals to manage it on their own, they won't, right? And Dr. Robby's situation is a manifestation of that. It's an exemplification of just how much we cannot. The solution is just to completely disengage and wipe their hands for a little bit and try to you know dissociate from the problem. So a physician health program is an outlet. It's a resource where we try to engage individuals with early intervention, right before they need to go on sabbatical, before they illness rears its ugly head at work, or before it starts to disrupt their home life in a way that bleeds into their professional life. The earlier that someone can intervene in an illness, the better chance of success they have for not to exacerbate or to increase in intensity. So, a physician health program is one part of that, um, and that's not to say that we're only here for early intervention. Physician health programs can deal with a variety of situations, and what we like to do is educate health systems. You don't really have to wait until things get to a certain point. You can engage with the physician health program early on. The more resources that you have at your fingertips, the more resources that you can provide an individual at the beginning, you're increasing the chance of success.
Yeah. One more question before you have to scoot. What is your hope to come out of this representation for what Dr. Robby represents, for what Dr. Langdon represents, and Pennsylvania as a whole?
I appreciate that question. It would be my dream that physicians, healthcare professionals, their administrators, the health systems recognize that the conversation is stepping away just from illness and or impairment, but that there's resources out there, right? And the disconnect is helping people, individuals engage with these resources in a meaningful way so that someone's fully supported, so that someone can engage in what we know to work, right? Um, Physician health programs have a tremendously high success rate where if you're engaged in the program, around 75% to 80% of our participants are successful in addressing their mental health issue or substance use disorder. They're maintaining gainful employment. They're they're rebuilding relationships. They're re-engaging with their families, with their coworkers in a way that is really genuine and fruitful and healthy. And not enough, uh, at the end of the day, not enough physicians, not enough healthcare professionals are provided with these resources. So I think with more awareness, I would like to see more engagement, not only from the individuals in our programs, but I would like to see support from our stakeholders. I would like to see our health systems invest in programs like ours, supporting their employees, engage in our program. I would like to see our legislation. I would like to see our regulatory bodies really support the confidential pathways that exist that we can carve out for physicians and other healthcare professionals to seek the care without fear of losing their license, without fear of losing their job. And at the end of the day, what we need to do is really remove that misconception that if there's a problem in my life, I'm automatically going to lose my job. I'm automatically going to lose my license. It's quite the opposite, right? I think we need to amplify the message that if there's an issue, if there's a problem, seek help. And by seeking help, you're not only investing in your health, but you're also preserving, uh, you know, uh, your chosen profession.